What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering the G-tube replacement protocol. So to give you context, I am a night shift Xray tech. Been doing it for over 4 years now at a Trauma 3 ER in the great state of Texas. So for those who do not know, the G-tube is a little tube that's like right here in your tummy, and they use it for feeding. So essentially what happens is most of the time patients who have them, either they get pulled, it gets tugged, it quits working, it gets clogged, whatever the reason, they'll show up to work, to my job, and they're like, it gets replaced. Or maybe they want to see if it's in the right spot still, or whatever the reason is. I will say, some people who come in and get it done are normal people, just everyday normal people. Other times they come in and they're special needs people, and they're contracted, and so it can vary, right? And essentially what we do is the most fluoroscopy Miguel gets to do at night, if you considered it fluoroscopy. Essentially, I graft a little bit of gastrographin, and then I put it down the tube. It has, depending on what kind of tube it is, the little end, sometimes use the big old 60 cc syringe, like the big ones, and the little tip goes in it, and then you just push the contrast, little tiny bottle of gastrographin, you push it in there, and you take a X-ray before you inject contrast, and you take one after you inject contrast, and you flush it out with water. Now, if it's a little kid, or if the patient has, depending on the tip, some of them, they use like the purple one, and it doesn't have like a tip, it has like a little screw on one. So I've seen like 2 different kinds of tips that you use to inject the patients. A lot of the time the babies, it has like a little Mickey Mouse button type of deal, and you just screw it in and you inject. Obviously, if you're doing like a baby or smaller patient, you don't need as much contrast. And depending on the patient and how much contrast, sometimes you're going to need a little bit more contrast, because other times we'll inject like part of it and then we see that the contrast didn't go all the way in, so we inject more, and you can kind of see, it all depends on what the radiologist reads and if he wants more contrast, or if the image isn't optimal. I would say, since you're shooting contrast, shoot a little bit hot, just a little bit more higher technique, since it is contrast. And especially if they're special needs people and they're contracted to the side, try to get them as like on their back flat as possible. We do it laying down, just so you get a better read, because depending on how they're laying and if they're not straight, the positioning of, like, it will be off, and it will be harder for the radiologist or for the ER doctor to tell if it's in the right spot. But for the most part, it's not too hard. You just, most of the time, it's like an upper abdomen. That's kind of where it lays, and the contrast will spread in the middle. And it's not too hard. You just, chart how much contrast you gave them. Usually ours is like 30 cc's. For babies, a little bit less, and then you document it. And that's really about it. It's nothing too crazy or hard. Now, I will say, depending on who the patient's family member is, it could be, you can get into situations where they're right there and they want to know everything, and it gets a little bit more hectic. I've seen it where you inject the contrast and maybe you don't have the right tip, and you go back and it's not as smooth as a process, and you're trying to inject it and maybe it won't get down, because sometimes the patient will come and maybe their thing isn't working and they don't get it replaced. They just want to make sure, like they're trying to see what's happening. So like you'll try to inject it and it won't go down. And I've had it to the point where I was like on a smaller patient, and the family members were asking all these other questions that I didn't know. It sounded like more like doctor questions than a Miguel question as an X-ray tech. And I remember one time we couldn't get the contrast to go, and like the patient's family member kept on asking all these other stuff, and like it was getting to the point where I wasn't feeling comfortable doing the exam because like how the patient's family member was being with us. And we're like, you know what? We're just gonna stop. We'll get the doctor in here to answer all your questions because you don't seem like you're good with us doing it. So we just kind of like backed off and let the doctor come and talk with them and kind of assess their problems or assess their concerns. And then once that happened, we came back and they were more chill. So I guess just due to prior experiences and stuff like that, I've seen it'll be a little bit different. But the most part, it goes pretty smoothly. 2 pictures, in and out, 3 to 5 minutes. Just be careful with contrast. That if it spills, I would put like a little towel wherever you're injecting, just so the contrast doesn't spill on the patient, because it is sticky and it will show up if it's on the outside. But yeah, that's really about it on that. So if you want to know more about the field of radiology, you can check out my channel. Post daily videos. If you want some laughs and some memes, you can check the link below, and we'll see you on the next one.